Hey guys, Dr. Vaughn here for Ask Dr. Vaughn. This is one with limited chat. Let me turn around the phone so I can see exactly joining us and where you're at. Boy, lots of people jumping in right at the start here. Oh, even Shannon Grosskreutz. Yes, I got it correct today. Telesellers, thank you for joining us. We're glad to have you all here for today's Ask Dr. Vaughn. It's actually after work today, so and Brendan Tork, thanks for joining us. A little bit relaxed. Yes, hello. Yes, hi, Shannon. Yes, thank you for confirming that I did get it correct. And Brendan Tork, thank you for joining us. Yes, hello. MBTVR, Kenny Urum, thanks for joining us. We're glad to have all of you here. Getting back into the week, we got Dr. Gwen Vaughn back at the office today. Of course, we weren't able to show you Dr. Gwen. Hey, good to see you, Prime Mills 9. Hey, Kenny Urum, good to see you. We weren't able to show you Dr. Gwen Vaughn even though he was back at work. Oh, Angela, stay on this time. Just watch. Nobody sees you. Nobody hears you. Just watch what happens here. Jason Pro, thanks for joining us. We're glad to have you here too. The reason that you guys didn't see Dr. Gwen Vaughn at work today was because we were just getting back to normal at the office after he was gone for a week. So there was a lot of catching up to do and we just did not have time. Oh, also, we went out for somebody's birthday at the office, so we were away during the lunch hour, so we weren't able to do Ask Dr. Vaughn during the lunch hour. Sock Cop calls you Shannon unpronounceable. Sock Cop, I'll have to, I don't even think he knows who I am. I'll have to get on there again. Somebody's asked, I think they asked about Dr. Gwen Vaughn. Same last name, not the same first name, not the same middle name. But yes, same last name, Dr. Gwen Vaughn at the Auburn Medical Group. He does have the same last name. And thank you for those hearts, people. Thank you very much. We appreciate getting the hearts. That's a very nice thing for you to do. And it's also nice, if you have friends who are interested in medical topics, to swipe to the right and tap to share with your friends who would like to have access to conversation about medical topics. And over the weekend, after we had recorded the Medically Speaking Radio podcast and then I was posting it, I found that I needed to clarify that it's not doctor-patient relationship over Periscope. We're not treating medical illness here, but we do talk about it, and so we may talk about things that people have just so they can have better understanding of it, but it's not meant to replace relationship with your own doctor. But with that out of the way, we can certainly talk about medical topics. I'd be glad to. Or somebody is wanting to know, Elsa Jennings, thank you for joining us. We're glad to have you be a part of it too. And Empire City Ray, there's a familiar name. Thanks for joining us. We're glad to have you jump in on this nice little Ask Dr. Vaughn after work. Getting back to what I was talking to. We had the show on Saturday, Medically Speaking Radio, talked about a lot of Empire City Ray. Hello, yes. What are the capsules made of, and could it be dangerous, overlooked? They're made out of a type of gelatin, I believe. This is opinion. This is not necessarily based on me looking it up and confirming it. And it is very easily taken care of by the digestive tract to make it into a harmless substance. I have, oh, Angela Hackett, welcome back. We're glad to have you join us again. Not known to have any problems with that. How common is it to be described with ADHD in adulthood? It does happen. It doesn't seem to be something that people get over with just because they grow up. I'm reading up on Kernig and Brudzinski signs. Yes, Kernig and Brudzinski. Kernig is, let's see, is that the one when you flex the hip and the knee? And Brudzinski is when you flex the neck. I'm trying to remember. Anyway, these are two things that people will do to look for meningeal irritation, or irritation of the lining of the central nervous system. So this coating you have over the entire brain and spinal cord, if it gets irritated or inflamed, like meningitis, the meninges are inflamed, you pull up the head like this, and it's very, very stiff. And if you have the let's see, hip and knee flexed. Oh man, you're going to have to help me with this one. It's been a long time since I've elicited a Kernig or Brudzinski's. But anyways, there are ways of indicating that there's irritation. You find that you can't really, with the neck flexed, flex the knee and the hip, or the other way around. In fact, when somebody has true meningismus or irritation of the meninges, when you pull up, they're lying on their back, you put your hand behind their head and you pull it up, and instead of their head coming up, their neck is stiff, and you pull on the head, but the whole body's coming up with it because the neck doesn't want to bend. And that's something you'll see in patients with severe meningitis. There's just such inflammation, and the muscles are so tight that don't want to let that bend. It's my understanding of how it occurs. Anybody who's reading on it there, go ahead and correct me if I'm getting it a little bit off there, but that's pretty close to what's going on. Meningitis, a horrible infection, and thankfully now for the most common types of contagious meningitis, the ones that strike down youth in their prime, or youths, depending on which movie you're watching, you can now get this vaccine for your kids. And let's see, I'm sure that Angela has it for all of her kids at this point. We have it for, I believe, 3 of our 4 children. One's coming up to the age to get that. And it protects against this contagious form of meningitis that you see in high school students and students in college and military recruits. These are places where people are in close proximity to each other or at an age when they're sharing a lot of... oh, Angela, you commented. Oh, sorry, I didn't mean to hit the mic. That's so nice of you. Oh, and hello, Dr. West. Thanks for joining us here. So you want to get them this vaccine. It doesn't cover all the types of that type of meningitis. It covers most of them. There's one type that they had an outbreak of at the University of Oregon earlier this summer, and then we didn't see that. They didn't have the vaccine before it hit, but they were able to get it distributed to the students shortly after. There was at least 1 death in the cases they had there. It is a very high mortality rate, approximately 10%, and I do believe that's pretty close to what they had up at University of Oregon when they had that outbreak of that form of meningitis. And some colleges are requiring what? Requiring the vaccine or the special one that was only available at the University of Oregon. And the reason I ask about that is because the type of vaccine they had at University of Oregon, I can't give to my patients. It's only available where they're having outbreaks right now because it's brand new and it's limited in its distribution. And that's okay because it's very rare that you have these outbreaks of this particular type. Yeah, the normal vaccine. Okay. Yeah, I would think so. Okay, somebody's asking about the app called Figure One. I have played around with Figure One. Figure One, I guess a good way to describe it would be a Instagram for doctors. And I'm not so sure it's just doctors on there, so I'm a little concerned about it. I have not posted any pictures on it, but I have posted comments. And my reason I don't think it's just doctors is because I've seen the comments on the pictures. That doesn't look like a community of doctors like Doximity or Sermo, where only doctors are a part of it and they clear you before you get on it. I got onto Figure One and nobody asked me my credentials at all until after I'd been on it a while. I still haven't finished giving them my credentials to fully open up my account on it or my membership. Somebody asked about the Ebola crisis. Is it no longer a death sentence? I believe it's around 50% mortality, Ebola, and it is still there. They cleared it out of Senegal or Sierra Leone, one of those African countries on the west coast that starts with an S. I don't remember which one. But still, it's very present in the other 3 countries, I believe it was, that were right in that area of West Africa where it was a problem. Sierra Leone. So they cleared it out of Sierra Leone, and so they still have it in, I don't know, I want to say Zaire and Congo, but my West Africa geography is not that great, so I don't remember exactly. Ivory Coast, I think, was there. Can you completely cure it? You wanted to say cure. When somebody, one of those half of the people who get over it, they actually have antibodies to it in their blood that can be given to people who are then exposed to it. It can be protective, and they're using their blood to help to protect the people who are in danger of getting or actually get Ebola. They give them their antibodies. Months back, someone asked you for your opinion on HPV vaccine. Actually, Empire City Ray, that was this weekend also that somebody asked about that, and we talked about it a little bit about how I recommend getting that for boys and girls to help prevent cervical cancer in the next generation. Value of Figure One is heterogeneity of human phenotype. Didn't quite get all of that. Sorry about that. Yeah, Figure One, not so sure on that one. We'll see. Yeah, HPV, back to that. That is a vaccine that helps protect against several forms, yes, I'm for it, several forms of HPV. It is a good thing. We do not see anything bad with it. Early on, there were some deaths in girls, this was back when it was only in girls, who had received the HPV vaccine, and so there was this concern that it was possibly the vaccine, because they had the vaccine, then they died. And what they did was a study to find that None of those deaths could at all be attributed to the vaccine. They all had very obvious causes that were separate from it. And the mortality rate with those girls was actually no greater than the mortality rate of age-matched controls that hadn't received the vaccine. So it turned out that even though that was a little scary looking there, it was just coincidence and not actually the vaccine that had caused those deaths. So now we're able to give that comfortably and know that we're helping. The only downsides are it hurts. It's different vaccines hurt to different extents when you get them. Flu shot, you don't really notice it at all. Tetanus shot, you're a little sore the next day. HPV, it hurts after you get the shot. So that's a downside to it. And it takes 3 different shots, so that's kind of a downside too. But I do recommend it. All right. And Dr. West, I'm glad. And Empire City, I'm glad. Thank you for the thumbs up. And thank you for the hearts too, by the way. I appreciate that. So, HPV vaccine, meningitis vaccine, a couple of things we talked about. Chloe Marie Mom, we are glad to have you join us also. Thanks for coming to the Ask Dr. Vaughn Periscope. This is a unique Periscope in that only people who I follow can comment, which is pretty much anybody who follows me. If I don't already follow you, just follow me now, and I'll follow you after we get done from there. Chloe Marie Mom from Indiana, we are glad to have you be a part of this. We have people from Indiana, we have people from Nebraska, we have people from Texas, we have people from wherever Dr. West is from, and I'm in Northern California, so we have quite a good representation of a good part of the United States, and probably beyond, I would guess. If there's anybody from outside the United States, just go ahead and type in what country you're from so we can know where else people are from. How often should you renew the tetanus vaccine? If you're not getting any open wounds at all, any injuries, where the skin's broken, once every 10 years. If you are getting these breaks in the skin all the time, or puncture wounds, or dirty injuries, or burns, or eye injuries, you want to get it within 5 years. So oftentimes people will come in, it's been 6 years since the last tetanus shot, they have an injury that would be a tetanus-prone wound. We renew it at that point, even though it's not been 10 years, because we like to keep it up in anybody who has a tetanus-prone wound. Vaccines, dead viruses given to the body. Some of them are. Some actually are dead viruses or inactivated viruses. Flu shot is not. Flu shot is just a protein taken off of a virus, so there is no way to get an infection from it because it's just a protein. That's all it is. The early Salk vaccine for polio was actually a form of the virus itself. The old vaccine for smallpox, the variola, was actually a virus, but it was a different virus. It wasn't the smallpox virus. It was a related virus. Most of the vaccines now are not live viruses. How do you consult someone who refuses helpful medication in favor of unproven natural remedies? I had her today. I mean, I had one like that today. Yeah, you just have to do your best to present evidence as best you can, showing that there's ways to know medical facts. There's ways to test things with well-designed clinical trials with placebo controls, and to analyze that data. And then there's also bad ways to make judgments on this. And there's lots of bad ways to assess the data that's out there that you find on the internet or other places. And so it takes a little bit of knowing the subject and knowing statistical analysis and study design to be able to do that. And actually, I'll tell you what, I've been at this a long time, went through residency and statistics courses and journal clubs, and even I don't consider myself to be fully able to read an article in the literature, a study that's been done, and tell you for sure whether it was well done and what the results, whether the results are usable. I go to people who I know who know more than I do about study design and statistical analysis, and I listen to them, people that I trust. And we find that that's what it comes down to, is trust. The people who are using all the natural remedies or not getting the vaccines, they have found a community where they really connect with people and they trust what they're hearing from these people because they have something in common with them, maybe a common bad experience. For example, all the people with autism in their family, they would connect with other people with autism. They find that they are telling them that the vaccine caused their autism. They say, okay. But because it's somebody they have a relationship with and they trust, they see that as something that's a lot more believable than just facts and figures without a relationship associated with it. And so I try to have a good relationship with my patients so that I can use that along with facts to help them to understand all the medical information that's hard even for a doctor to analyze, let alone a layperson. There's an excellent video on this whole thing called The Science of Anti-Vaccination by Hank Green on YouTube on his channel called SciShow, S-C-I Show. I recommend it highly, very highly. I recommend that video by Hank Green. He does a great job of going over what I just explained, but in much more detail and with a lot more example of biases that we come at any subject with, and anybody does. You have to really check yourself to make sure you're objective when you're looking at something. 1221 Dot says, "You are very good." I think he's talking about me, or he or she. I'm sorry, I don't even know if gender on this thing. It's kind of hard to tell. Thank you for saying such a kind thing. I appreciate that. So I hope that helps you guys out with a little bit of the whole medical information. How do we talk to people? And I did have somebody today. Tried to make some progress on it. We'll keep working at it. Thank you for the hearts. Thank you for sharing with friends. Thank you for following. Until next time, this is Dr. Mark Vaughn telling you to stay in good health.